Superintendent. Let me join Dr. S.S. Agarwal in welcoming our chief guest, Shri Phaggan Singh Ji Koleste, Minister of State for Ministry of Health and Family Welfare, Shri Muralidhar Rao, Shri Vijay Jindal, Mr. Ambar Agarwal, Dr. K.K. Agarwal, and Dr. Temin. All distinguished members of Indian Medical Association, experts, and delegates and participants of this very important conference. A very warm welcome to this important initiative of the Indian Medical Association, Bharat Niti, Rashtra Nirman, and IIHMR. We at IIHMR, the Indian Institute of Health Management Research, and IIHMR University are honored to be the knowledge partner in this conference as being the pioneer in health management, policy and program management research and training in public health. Sir, our country is passing through a historical phase where the hopes are high. Economy is growing fast, and several development milestones have shown a significant improvement in the past 2 decades. In the area of education, poverty alleviation, and improving health status of the women and children in this country. This conference is very timely as the national health policy is in the making. The most significant is the initiative of the Indian Medical Association to contribute to policy dialogue and focusing on the rural health in partnership with the political leadership, academic and research institutions like Indian Institute of Health Management Research, which specializes in policy and program management research, National Health Systems Resource Center, experts, practitioners, and NGOs. There is a very important group also in this conference who are participating are the young management graduates in the health sector who will be playing an important role in shaping the future healthcare in this country. As Dr. Agarwal shared with you, the basic idea was that the health is at the core of development, and in our country, the majority of the population lives in the rural area. So the broad objectives of this conference are lined up accordingly. First, to really have a deliberate on the status and challenges in rural health with specific reference to, which is a major issue, that is access, availability, affordability and quality of healthcare in the rural areas. This conference will also revisit the existing policies and also provide inputs to the future policy. And fortunately, I said it's very timely because the new health policy is in the making. So IML's initiative is very, very well appreciated, and this conference will provide inputs to the new national health policy. And we'll look at the sustainable development of this country in the coming time. This conference is necessitated to bring greater focus on the health of people in the rural India, where 72% of the population out of 1.34 billion people live in the rural area. Traditionally in India, the focus of healthcare has been on the rural population, right early on since independence. Somehow there has been a skew over a period of time, and the skew towards urban population, urban infrastructure and urban health. And despite being more allocation to the rural areas, we still find the access to healthcare, the availability with good quality and affordable care is still lacking. So here is an opportunity how we can refurbish, revitalize primary health care and give a renewed focus to the rural health in this country. So in the past 7 decades, it's not, I'm very happy to share with you, and we have to be very honest to give credit to our national policy makers, that in the past 7 decades, the healthcare systems in India has been able to develop a vast network of healthcare institutions. There are about 153,000 and more sub-centers now spread over the country. More than 25,000 block primary health centers are functioning, and over 5,000 community health centers are functioning, besides the district hospitals and the private sector in a big way that is providing care. It's not that we have not been able to achieve the health goals or improve health of the people of India. If many people sitting over here know about this, that what was our crude death rate at the time of independence? It was 27 plus per thousand population, and what it is now, it is 7. So it is drastically reduced, but this has happened in 70 years. So though there is a reduction, we have achieved something, but it has been slow. Can we increase the pace of reduction of death rates? That's one major question. So not only the health infrastructure, but a huge human resource, the doctors, nurses, laboratory technicians, compounders, all are engaged in delivery of care. But the key issue is that how does it work? How efficient is this? And how effective is this in delivery of care and achieving the desired outcomes? I just wish to share, and I don't want to repeat, and I also don't want to predicate what other speakers are going to speak on this issue today. But we had Health for All way back in 1978, and we decided Health for All by 2018. We could develop infrastructure in this country and focused on primary health care. Now, in 2000 onwards, Millennium Development Goals and the targets were set for India as well. I'm very happy and proudly share that to a great extent, the major goals, particularly 4, 5, and 6, the child mortality reduction we have witnessed in a big way. It is reduced to half as compared to 1990, which was 80 at that point of time, which is less than 40 now. The maternal mortality rate, which was unacceptably and shamefully high at 556 odd, is reduced to 160 now. The infant mortality rate, the child mortality rate, maternal mortality rate, under 5 mortality, all have come down. A very good feature that has come in is that our population is getting stabilized slowly. So the total fertility rate has also declined very significantly. And about 24 states now in India have achieved replacement fertility levels. So which is a big achievement, that the 24 states have been able to achieve replacement fertility. That means the population will not grow in those states. The population which die will be replaced only. So that is what we have been able to achieve, the Millennium Development Goals. Now we face many challenges about access. Are the services accessible? Is the quality of the services is good? Is healthcare affordable? I think these issues are very well known. But there are unfinished agenda of Millennium Development Goals. The new problems like non-communicable diseases and disease burden due to non-communicable diseases is on the rise, And we want to underline here that this will also happen in the rural areas. The rural population will also suffer from non-communicable disease. They do not suffer only from diarrhea and typhoid, but they will also suffer from chronic pulmonary diseases, cardiovascular diseases, diabetes, and likewise. So the focus of rural health must also be on that now in coming time. There's a big problem about ability to pay for services, particularly in catastrophic illnesses. And where do they go while the cost of care is rising? So the financial protection, in our new policy, we need to focus on universal coverage. That means improve access, improve availability, improve quality of services in the rural areas. I wish to also underline here, despite the vast network and perhaps the largest in the world, our quality of services is questionable for various reasons. The inequities are so sharp and so glaring, we need to really bridge. It's not only geographic inequities, but social inequities, economic inequities. Poor people do not have access to health care. They prefer to go to the private sector, and out of the pocket expenses are very, very high. Those who need to be given care by the government prefer to go to the private sector. I'm not against any sector, but I'm just trying to put before that the rural people are really deprived, and I think we have a bias against them. Over a period of time, traditionally we planned for the rural health care. Dr. Satish Kumar is here, who will be speaking on a very interesting topic, down the memory lane, from Bhor Committee to contemporary health policies. So way back in 1944, rural populations were focused, but over a period of time, because of the market forces and all what has happened and the human resources that we produce, there is a skew for the urban areas. Urban areas have also problems, and particularly a new class is coming up in urban areas, that is urban poor. They have poorer health than the rural people. I think so the focus has to be both on rural as well as the urban poor. National Health Mission has transformed healthcare. It was started in 2005 as National Rural Health Mission. Now it has become National Health Mission, and the achievements have been very, very significant. But there is an unfinished agenda. There is a new additional agenda of NCDs, and the social protection or assurance, financial assurance or health financing to those who cannot afford health care are the questions need to be really addressed in our policy. So in this conference, the objectives are, which Dr. Agrawal said, I can repeat those objectives again: to deliberate on the status and challenges of rural health in India with a special reference to access, availability, equity, and quality of services, revisit existing policies and programs for rural health, discuss its relevance and sustainability to revitalize primary health care and introduce universal health care, to ponder on way forward for attaining sustainable development goals and accelerate pace of development in rural India. Finally, I would like to remind again, health is crucial for development, and India is a signatory to the UN's Sustainable Development Goals to be achieved by 2030. And the goal that relates to healthcare is sustainable goal number 3, that relates to reducing mortalities, reducing improving affordability, reducing inequities, and financial protection. With this, I'll stop here and look forward to participation of all the stakeholders, all political stakeholders, our experts, scientists, professional body that has come for the first time to give its opinion and make contribution to policy development. They do, but it is very timely this time. Before the document is finalized, they will be able to give their perspective to the new national health policy. Welcome you once again, sir. Welcome you all in this important conference. Thank you very much for being with us.